So, blood pressure spikes when nicotine is in your system. And in Summit and Portage counties, nearly 170,000 adults smoke every day. What's even more shocking is that 30% of high school students in this state are current, frequent, or daily users of electronic vapor tobacco products. You know of these products. They are e cigarettes or vapes. Many people think vaping is less harmful than smoking. Now, while it's true that e cigarette aerosol doesn't include all the contaminants in tobacco smoke, it still is not safe. I now want to bring to the stage Dr. David Custodio, President elect of the American Heart Association Board for Akron and Portage counties. He's also the lead of our tobacco pillar. Dr. Custodio?
Other members of the pillar, Cherie McLean, local actress and media personality, Corey Kendrick, who is the Policy and Legislative Affairs Manager at Summit County Public Health, and Rhonda Larimore, Chief Human Resources Officer at Akron Children's Hospital. You know, people ask, why is it important? Why did I pick the pillar? On a personal note, I lost my mother to lung cancer when she was just 51 years old, and I was a very young man. And so obviously smoking is important to me. In my professional level, I practiced emergency medicine at Summa Health and saw on a day-to-day basis how smoking affected people's lives and chronic health problems associated with it, not unlike Dr. Dunn and the other cardiologists who practice here in Akron. And then as a executive at Summa Health, where we're a population health company, we know how important prevention is, and stopping smoking is one of the key of things that we can do to provide good health. Prevention is the key when it comes to heart disease. 80% of heart disease is indeed preventable, and smoking is the #1 preventable cause of heart attack and stroke death, as Dr. Dunn alluded to. While fewer people are smoking now or starting to smoke than ever before, many are using other forms of tobacco and electronic nicotine delivery systems. And this increase in e-cigarette use, known as vaping, by kids and young people in recent years is a serious public health threat. So what are we doing about it at the AHA? We have panel discussions with students in local schools. You may recall that we had the e-cigarette panel discussion with some of the local students following our One Heart in January. We have smoking resources to help people stop. Call 1-800-QUIT-NOW. The Tobacco 21 legislation that we've been working with several cities passed locally, then state and federal levels passed. We're enforcing ordinances where several cities have passed local enforcement, and we need ongoing work in this area. Community conversations to provide education and awareness about the hazards of smoking. We need to continue to convene youth and community leaders to educate about the dangers of tobacco and e-cigarettes. The youth marketing programs like AHA Kids Heart Challenge, which educates students again about the dangers of smoking and vaping. Our Summit County Youth Vaping Task Force and Kent Vaping Task Force, AHA sits on these local boards, which focus on policy change, alternatives to suspension, and then educating the community. And then also there's the Quit Lying campaign targeting Big Vape, who falsely states that e-cigarettes are safe. So how can you help us out? How can your companies get involved? We need to make some of the following ideas come to life. And as we share the ideas that our team came up with, please feel free to share any ideas that you may have in the chat box. So do you have anti-smoking policies in place? Do they reflect vaping? Can you rewrite those, or can we help you rewrite those? Can you adopt a school and help educate them around tobacco and vaping? Can we be more positive influences for youth in our community? Can you help with a teen voice video? We need more panel discussions at local schools, and we need to continue to work with the national advocacy efforts. So if this pillar resonates with you like it did with me, please put tobacco in the chat box. And thank you again for everyone for joining, and let's take it back to our host, Cherie.
Thank you so much, Dr. Custodia.